Good afternoon, everyone. Good morning or good evening, depending on anywhere you are in the world. My name is Jimena Galvez, and I am the Legal and Policy Officer for the Europe and Asia region at Geneva Call. It is a great pleasure for me to be here and a great honor to be in the Paris Peace Forum to present Geneva Call's latest creation, the ANSA COVID-19 Response Monitor. Thank you so much to the Paris Peace Forum organizers, the IT people that have really helped us all pitch leaders to get acquainted with this remote system. So a big thank you to them and a big thank you to everybody who is watching us around the world. So I will start by sharing my screen now to start the presentation. So let's first start. My idea first is taking you through the outline of the presentation on what we will be looking at throughout these 20 minutes of presentation, and then we will have a 10-minute Q&A session. So we'll first start with an introduction, a brief introduction to Geneva Call, what we do, what is the organization about. Then we'll later move forward to talking a bit more about the COVID-19 ANSA response monitor, the rationale, the background information, the objectives of these tools, and then we'll move on to how this response monitor works. I would be happy to give you a short demonstration on how the response monitor works online and how you can identify the different measures and responses that we have included. Then we'll move over to see a bit of the sources and the verification and the triangulation methods that we use in order to identify the different measures and responses that have been included in the response monitor and that will continue to be added in the response monitor in the near future. Then we'll later see some opportunities to expand some ideas that Geneva Call has on ways forward as we want this tool to expand further. Without further ado, let me first take you through Geneva Call's mission. Who are we? So basically, we are a Swiss NGO working in conflict-affected areas to prevent abuses against the civilian populations. How do we do this? If we're a neutral, impartial, and independent international humanitarian organization, and we do so, by endeavoring to strengthen respect of humanitarian norms and principles by armed non-state actors. What do I refer by humanitarian norms? We're basically promoting and advocating for international humanitarian law, known as the laws of war or law of armed conflict, and international human rights law, which also applies in times of armed conflict. This is done in order to improve the protection of civilians, while also seeking to support local communities in their efforts to enhance their own protection in times of armed conflict. In this image, you'll see a fighter from a Myanmar armed group, which is showing a leaflet which Geneva Call produced on the protection of healthcare, specific messages on the protection of healthcare in the context of COVID. Now, I mentioned that Geneva Call advocates for humanitarian norms. We promote humanitarian norms towards armed non-state actors. But we do indeed focus on 7 specific thematics, what we call thematic areas of focus. The first one is the banning of anti-personal mines. And then we moved on to child protection, the protection of education, as well as the prohibition of sexual violence and the prohibition of gender discrimination. We have also delved into the protection of displaced people, the protection of cultural heritage, and our most recent thematic area of focus is the protection of healthcare, which we delved in since 2017-2018. Now, as we focus on the protection of healthcare, and there's a very, an important link between the protection of healthcare and COVID-19. Specifically, since December 2019, COVID has spread around the world to more than 200 countries, with over 51 million confirmed cases, overwhelming the most advanced health systems around the world, and killing over 1 million people. So the threat of COVID-19 is even greater in conflict-affected areas, especially for communities living in active conflict or living in territories that are controlled by armed non-state actors, what we refer to as ANSAs. So having that in mind, Geneva Call decided to move forward and prepare a global advocacy strategy specifically tailored to the COVID-19 situation. Now, this is where the COVID-19 response monitor came to be. So it's basically, the COVID-19 response monitor is a tool that tracks a variety of responses and measures that have been adopted by armed non-state actors, either to prevent or to address the COVID-19 or its side effects as well. We can see that it's a complementary tool to Geneva Call's overall COVID-19 global advocacy strategy. Now, we had four main objectives for the COVID response monitor, which was first of all giving visibility to the measures that were adopted by armed non-state actors in hard-to-reach areas, in conflict-affected areas, in contested areas. It was quite important to give visibility. And as a background, it's good to acknowledge that when the pandemic initiated, when it became very problematic, we saw that many institutions started preparing trackers, different types of trackers, identifying government responses to the COVID-19 disorders trackers. Then we had cultural and COVID-19 impact response monitors, ceasefire trackers around the world. So we see that there were many initiatives that were created to try to follow the different measures that were being taken around the world to tackle the COVID-19. However, we as Geneva Call noticed that there was a big gap. There was no tracker following armed non-state actor measures or responses around the world. And this is the reason why we decided to create this specific tool aiming to bridge or to fill in this gap. Now, of course, this tool also supports us doing our monitoring. We do indeed do web monitoring. We do indeed do field monitoring of the different practices, policies, and attitudes of armed non-state actors around the world concerning the 7 thematic areas of focus that I mentioned previously. So indeed, this tool has also supported us in monitoring the different types of attitudes that we've been seeing throughout these months. Now, we have 2 additional objectives that indeed do complement each other, which is the facilitation of coordination amongst armed non-state actors and governments, among armed non-state actors, civil society organizations, and among armed non-state actors and aid agencies. So we saw that there were many armed groups that were taking measures and that were asking for help in the field in hard-to-reach areas where aid agencies were absent, either because it's difficult to access the area or there's no authorization to access the area. So in this sense, the tool, this response monitor, was able to give visibility to these types of measures and facilitate coordination between armed non-state actors and other stakeholders to find solutions to the issues that they were having. For example, armed non-state actors can carry out awareness-raising sessions on how to prevent contracting the virus, but many of them did not have personal protective equipment to distribute to the population, such as hand sanitizers, face masks, gloves, etc. Now, the 4th objective was also to support other humanitarian organizations in the development of the strategies. As these areas or conflict-affected areas are sometimes very difficult to access and very difficult to grasp, this tool also aimed at supporting humanitarian organizations to prepare well-rounded crisis response and preparedness strategies. If they don't know what's going on in those areas, it's very difficult to come up with a well-rounded strategy that tries to, provide aid to the different segments of the population that are most affected. So these were the main objectives of the response monitor. Now, it's also quite important to acknowledge that we are funded, that this tool was partially funded by the European Union, and for which we remain quite appreciative. Now, of course, the response monitor, it tries to provide a clearer picture of the situations in armed non-state actor controlled areas and other conflict-affected areas. Also acknowledging that international support has largely focused on states, thus overlooking populations living in territories controlled by ANSAs or contested areas that may be in an even worse situation than the territories that are controlled by the government. Now, what about the target groups, the type of armed non-state actors that we have included in the response monitor? You'll find that we have a wide variety of armed non-state actors in the response monitor, from de facto authorities to movements of national liberation, paramilitary units, as well as gangs and cartels. Now, it's also quite important to mention the disclaimer. We do have a disclaimer, and we try to emphasize this just to not create too much expectation as well, and be as realistic as possible with this tool. Of course, this tool, it does not purport to be comprehensive or exhaustive. We don't intend this tool to basically portray all of the measures that have been taken by all armed groups around the world. We're not in a position to do so, and identifying measures and verifying them and doing a triangulation to make sure that these measures are as accurate and objective as possible takes time, and it takes human resources. So we do not purport it to be exhaustive. There are many other measures that perhaps have not been added yet to the tool, but we try to be as comprehensive as possible. Now, this tool serves for information and documentation purposes only, okay? It's only to inform people of the different measures that have been taken around the world by armed non-state actors, but it does not imply any endorsement or approval of the measures that we have uploaded. It also doesn't imply that the responses or the measures that have been included are in compliance with international standards or implemented, okay? We're not saying that they do comply with international standards. Now, Geneva Call, of course, we bear no responsibility to monitor the implementation of these measures. There are many, many measures that are actually, you can't count them, and you can't really know in some areas what types of measures they're taking, but we do not bear any responsibility to monitor the implementation of the measures. And what we want is that the tool basically serves as information for other organizations that can implement these measures, that can follow up with these measures. So indeed, we don't bear any responsibility, but we give enough information so that others can also move forward with implementing or monitoring these measures. Now, before I continue, I will first give you a nutshell of what we have in the response monitor at the moment. We have responses, we have measures in 27 different countries at the moment, from 74 different armed non-state actors. So you can see the disaggregation in the screen to your left, depending on the region, and also see that we have measures that have no territorial scope for armed groups that, of course, are not specifically, linked to a certain territory, but are in fact can be found around the world. There are approximately 350 measures, which is growing week by week. And luckily, we have reached 11,000 people that have accessed our COVID response monitor. And we've gotten very good feedback from other humanitarian organizations that are using this as a tool and are actively seeing what new measures we're uploading. So, I want to take a quick break now to show you and take you directly to our website so that I can show you how the response monitor works. So we're here at Geneva Call's website. This is the COVID-19 Armed Non-State Actor Response Monitor. As you can see here, if you click here, you have responses without a territorial scope. Then you have the disclaimer here, which is quite important to also look at. But I'll take you through some of the measures, and we'll start with Asia. In Asia, if we go to Myanmar, you'll see that we have a list of different armed non-state actors for Myanmar ethnic armed organizations that have taken a variety of measures or responses. If we click on, for example, the Restoration Council of Shan State, we see, for example, one of the measures that we have identified in which the RCSS mentioned that they can provide healthcare education, but they can't afford preventive disease spreading supplies. You click on the source, and it will take you directly to the news outlet where the RCSS has basically made that statement. Now, if we go back, let's move on to Europe. And let's go to Ukraine, for example. We have measures from the Donetsk People's Republic. We have measures from the Luhansk People's Republic. Let's go to Donetsk People's Republic. There's a very interesting measure which is linked to taxes, the payment of taxes. So of course, these are more institutionalized measures, responses. It's an order coming from DPR where they basically are pardoning businesses and private individuals who had to postpone their operations and had no income. They've exempted them from taxes, from paying taxes. But it's also, trying to address the side effects, the social and economic side effects from COVID-19 on the different segments of population. Now, if we move to Middle East, let's go to Syria. In Syria, you have, of course, a list of armed groups that have adopted certain measures and responses. If we go to Division 5 from Northwest Syria, you'll find a unilateral declaration on the protection of healthcare that has been signed by this faction of an armed group. You click on it and you have the unilateral declaration. You have access to this document as well. We have provided for some of these documents English translations, which you can also look at because we don't foresee anybody speaking all of these languages. So we try to make sure to include the English translation. But also note that we also include summaries, as you have seen in the one for Myanmar, when they are in different languages from each one of the measures. Now, if we move to Africa, we go to Mali. Mali, the Coordination des Mouvements de l'Azawad, also had very interesting measures, one of which was the release of 21 detainees considering the COVID-19 pandemic and the month of Ramadan. So if you go to the source, you can go directly to the decision from this specific armed group where they have decided to release 21 detainees. And of course, it contains a short summary below the title. Now, if we go to the other side of the world, we have also a variety of different measures that you can find either in Colombia, in Brazil, in Honduras, El Salvador, Mexico. So you'll see here the list. You'll find ceasefires as well that have been unilaterally agreed upon by the ELN. And if we go to Mexico, you'll have access to, for example, measures on handing out food supplies, groceries to families that have been affected by the COVID-19 by cartels in Mexico. You click on the source and it will take you directly to the news outlet where you can find that information. So that was just a quick demonstration of what you can find in the response monitor. Now, perhaps now you're asking yourself, how do we verify these measures? There's so many measures. How can we make sure that they're as accurate and as objective as possible? So first of all, we'll start by saying that our sources are either primary or secondary sources. When they're primary sources, they come directly from the armed group itself. It can be letters from them. It can be specific statements from them that come directly from them or their websites, okay? So we usually ask authorization from the armed group, whether we can upload it in the response monitor, and then we proceed to upload it. But when we're talking about secondary sources, we need to be a bit more careful here. So for secondary sources, we may refer to news outlets, we may refer to articles, academic articles, for which we need to do a verification process. In this verification process, once you have a secondary source, we try to identify at least 3 news outlets that have responded or have reported the same response, and we need to check the sources of this, the secondary source. It can either be a local or an international news outlet or a source. Then we cross-check at the field level. We send these measures to heads of mission in the field to verify the accuracy of these responses, and staff in the field are responsible for double-checking these measures with both local partner organizations that we have in the field and other international organizations that may be present in the field. So once this measure, this response is corroborated by the field, the head of mission and the head of region provide authorization for us to upload the measures in the response monitor. As the last 2 stages, the policy and legal unit, they approve these, they check each one of these measures, and they are later uploaded every Friday to the response monitor by the communications department. So as you can see, this has been a very big team effort in these challenging times across all departments within Geneva Call, and it has really, solidified our teamwork, and it's made it quite visible. Now, we can see that the types of measures that I've showed you so far, they can be health-oriented, they can be protection-oriented, they can be social or economically motivated, politically motivated, and others that are more faith-based. So again, you'll see that it's a variety of measures which you will have access to through this tool. Now, opportunities to expand and ways forward. Indeed, the response monitor, we don't want it to just stay as the COVID-19 response monitor, but we may want to expand it to other health crises in conflict-affected areas such as Ebola, measles, other diseases and viruses. But what's more is we may want to expand to natural disasters in conflict-affected situations. So in this sense, there have been armed groups that have been adopting certain measures in order to protect the civilian population from natural disasters. And perhaps we may want to take this avenue, we may want to continue, tracking all these responses and offering them in a bigger tool. So we look forward to expanding our tool in the near future. And I thank you very much. This is a quick picture in the Philippines of our campaign to distributing protection of healthcare messages and posters. I thank you very much for your attention, and your questions are more than welcome now. The floor is open to questions. Okay, so I see first question. What are the main challenges facing the organization and its operations? Do you face a lot of pushback by governments and other stakeholders? Okay, we'll start with the first question. What are the main challenges facing the organization and its operations during COVID? I think many of the organizations are facing similar issues, which is where we can't travel. We can't travel. So there's lockdowns. We can't move as quickly as we would want to. Many activities have been postponed, but we have tried to address this through doing communication campaigns, moving and thinking outside of the box, not always carrying out our activities, in person, but also doing them remotely through radio campaigns. Again, local staff, field staff have played a crucial role. Our expat staff had to, go back to their countries, and field staff, local staff have stayed with operations, and they have been keeping basically the wheel going. So they've played an immense role. The responsibility for field staff has increased even more. And you also say, do you face a lot of pushback by governments and other stakeholders? In some scenarios, we do. It depends on each country, it depends on each region, but I would say it's crucial for Geneva Call from the onset to present our mission, to basically go through a trust-building relationship with the government, with the state, so they know that we're not doing anything that is prohibited, and that what we're trying to do is enhancing protection of civilians in a conflict-affected country. So indeed, sometimes it's difficult for some governments, for some states, for some stakeholders to understand this. So this is the reason why we need to do a lot of groundwork, a lot of meetings to introduce our mandate, what we do specifically. So with regards into the COVID situation, pushback by governments, I think we've all had them. All national governments have been taking measures which have not allowed us to enter into some countries. There's also an issue that needs to be discussed, is that sometimes expats are seen as staff that are taking the disease to communities. So we need to be careful, as our duty of care and do no harm, that the staff that we have remain healthy. And if expats are not allowed in certain areas because there's too much sensitivity and there's too much, we don't want to make communities uncomfortable or civilian audiences uncomfortable. So we try to identify other means of reaching our goal. In what ways are the responses of armed non-state actors influenced by those of state actors? Indeed, I mentioned that there are some measures that are more politically motivated, and I would say reputationally motivated. There have been situations around the world where armed groups have adopted unilateral ceasefires as a response to governments not wanting to declare ceasefires. They themselves do so in a unilateral manner. However, these tend to break down quite easily as there is no, bilateral, there's no response from the government on the other side. So we indeed have seen that some responses, have been shaped by the way governments have been responding, and that's a very good question. In places where there's not a lot of government presence, of course, armed groups have taken this opportunity to move forward, and to provide the support that the communities need in order to stay healthy and to stay safe. So indeed, yes, I have many questions, so I'm trying to go through them as quickly as possible. Have you seen a dialogue between non-state actors and actors to respond to COVID-19 in some territories? Yes, we have. I cannot reveal the exact situation, but there has been situations where our non-state actors have requested support from aid agencies and from the government because they just didn't have the material that they needed. They didn't have logistics to carry out the distribution of personal protective equipment. So they have indeed reached out to governments, and governments have responded favorably in some situations where they have tried to provide this support, provide all personal protective equipment, provide leaflets, information leaflets in areas where perhaps there's not a lot of government presence. So indeed, there has been dialogue between armed non-state actors and state actors to respond to COVID, even in a complementary way in some situations, which has been very positive. Okay, so do you see this tool being useful to disseminate a COVID-19 vaccine in conflict areas? Well, that really depends on how far we go into identifying a vaccine that is 100% accurate and that poses no harm to people who are willing to take it. So if, for example, the vaccine is created and it becomes, widely accessible to all populations, and it becomes accessible to armed non-state actors, then yes, indeed, we can include measures that include, the distribution or vaccination campaigns that armed non-state actors will carry out in the future, or hopefully near future. We would include this in the response monitor. What are the cultural considerations you incorporate in the medical attention in the conflict zones? Do you also support your actions with local knowledge? Yes. Indeed, I think cultural considerations and local knowledge, traditional knowledge, play a crucial role of how we disseminate information and how we go about, advocating for the protection of healthcare. Of course, in some countries, we need to be aware that maybe there may be some campaigns that can only be, delivered by women to women. So we need to take these cultural considerations and traditional knowledge considerations into account when leading our activities and advocating for the protection of healthcare. Of course, there's some basic obligations that armed non-state actors have with regards to the provision of healthcare and respecting and protecting healthcare. But indeed, we do try to match this with traditional knowledge and cultural values that communities where we work have. Okay, so it's time to wrap up. I'm sorry if I didn't get to address any of your questions. I will share my screen now. If you have any additional questions, please feel free to send your questions to this email here. http://www.genevacall.org/contact/. Okay. I'm sorry if I didn't get to answer all of your questions, but please feel free to forward your questions and I will be happy to answer them as soon as I can. Thank you very much for your attention and have an excellent day.